Hello, everybody. Dr. Alex Vasquez here. Today is Saturday, July 10th, 2021. I've had a few things on my mind for the last couple of days, and in some cases, the last couple of years that I've never gotten around to talking about. These are all relatively minor, but I thought that maybe now would be the time for me to talk about these things. And maybe I'm the only one who cares. I guess that could be possible. I just had a couple of weeks of sinusitis. Uh, so obviously I'm going to talk about that, but in context with black mold, which a lot of people talk about and think about and have problems with. So none of what I've prepared, well, I haven't really prepared. I've just written a few notes. We're going to go through these notes. This isn't like a presentation like I would normally give, which at best are recorded in the studio and then edited. Even though they're semi-spontaneous, I don't like prepare my lectures before I give them. I just give them. Uh, Usually on top of a slide presentation that I have put some effort into. So it's a slightly different topic. So I guess today is going to be me kind of like clearing out my ideas that I've had kind of floating around in my mind. So let's start by talking about the difference between a conversation, which is very casual, a lecture, which is a bit more formal and probably prepared, and then a formalized presentation, which is usually time limited, versus what is now sometimes referred to, or maybe it's always been referred to, but I've only heard about it for the last 2 years or so, what's called long form conversations, which can sometimes go on for too long. Uh, the first time I was exposed to that idea was in a podcast or a video podcast with I think it was Eric Weinstein, and actually it was a brilliant long form conversation, and maybe I'll provide a clip of that within this video once I do the editing. Uh, but most of you know I've been involved in education for a long time, and so these are some of the things that educational type people think about. What's the difference between a conversation, a lecture, a presentation, and now this thing called long form. So today is definitely not going to be long form, and I'll try to prevent it from being long form. Long form is just talking and talking and talking until you've talked about the whole thing. You basically talk it to death. And that's why if you look at the Weinstein presentations between Eric Weinstein and Brett Weinstein, sometimes their conversations do go on for 2 or 3 hours. I'm certainly not going to do that today. So today's going to be, my point is this, at least part of my point is this. Today's conversation is going to be mostly a conversation, not really a lecture because it's not that formal, and certainly not a presentation. With some idea of long form, which actually has some really awesome merit. And again, I'll try to show you maybe a clip from one of the exemplary long form conversations that I've seen. So that's all I'm going to say about that.
There's a famous quote, I think attributed to Einstein: make things as simple as possible, but not simpler. As simple as possible, really the goal is as clear as possible, right? But simpler would mean it's wrong, like it's not accurate anymore. If you're going to have to face this doing media work. There will be pressures on you to say, hey, people can't pay attention to more than sound bites. You got to make it 5-minute chunks. The word size is too big. Make it for an 8th grade level, right? Which is saying people are dumb, so spoon feed them stuff that dumb people can handle. Which, to the degree you do that and it's successful, will keep people dumb. If I want to be able to make sense of the world well, I have to work at that. And if I want to be able to make sense of the world better than I currently do, like attention requires being trained, just like muscles require being trained. Thinking clearly requires being trained. If I keep paying attention to hypernormal stimuli that are moving quickly, so I get the stimuli of lots of novelty, I'm going to be decreasing my attention. But if I want to have any kind of nuanced view, I have to be able to hold multiple partial views in working memory. It's not that some people have good memory or good attention and other people don't intrinsically, any more than some people are buff and some aren't intrinsically. It's developable, but it has to actually be developed. So the impulse to say, hey, make it really simple so everybody can get it, and the impulse to say, help people actually make sense of the world well are different things.
I'll talk about sinusitis and black mold. You can probably tell I'm still a little bit stuffy. I haven't used any medications or anything like that. I'll talk about medications in just a moment. I haven't used anything today, and I don't want to. So as a consequence of that, I am still a little bit stuffy, but it's because I don't feel like taking anything. I'll show you why. I'll show you how I do my sinus lavage protocol that I've been using now for a couple years, and I'll show you why it's the best and the safest. And to reiterate that fact, it is the best and the safest. So, a lot of people talk about doing sinus lavage or nasal rinse or saline rinse and things like that, and I don't hear enough people talking about the safety aspect of that. So I'll show you how I manage it, and you can maybe learn something from that. So all of this is just free. It's not even free advice. It's just free perspective. I'll talk about iodine and iodide and how I use those and how I would like to use them and how a reasonable person might employ them. I'll also show you the notes that I've already written that I've already provided access to, so you can download my perspectives on that in a PDF document if you don't already have the book, Inflammation Mastery, which is where I talk about it. I'll talk a little bit about mucosal immunodefense and immunotolerance, and then I'll provide a clip, which I'm going to record in just a moment. I actually just saw it a few minutes ago while I was looking at videos in my hyperbaric oxygen chamber. And a really inspiring clip, and I'll just show you maybe a few minutes of that. I haven't seen much legitimate leadership anywhere in the world since this whole COVID, and I don't like using the word COVID because it implies the whole COVID identification system. That's why I call it coronavirus 19, Cv19. So I'll talk a little bit about leadership and the lack of leadership, and I'll show you a good example of leadership in this new world order, otherwise known as the Great Reset. So I've had a few experiences. So we're going to topic number, whatever it is, number 2 here. We're talking about black mold, or I'm talking about black mold, but I have to think about my listener, my audience. So in that sense, it's kind of a virtual conversation. I've had a few experiences with mold. The first house that I bought in Houston, Texas, had a swamp under it, basically. And then when we bought this place a couple years ago, the basement was not finished. It was just a mix of cement and then some dirt. And we definitely had some black mold down there, but I didn't really care about it. And I still don't care about black mold too much, except when it bothers me, and recently it's bothered me, and that's why I ended up with a sinus problem, which was a little bit difficult to figure out because, in retrospectively, of course, it may be obvious, but this was the black mold that I had to get rid of. I only had sinus problems after the combination of cutting the grass and then using my hyperbaric oxygen chamber. So I actually thought the problem was maybe I needed to change the filters in the hyperbaric chamber, or maybe because it's spring and we have more pollen or grass, or I was cutting the grass, a couple of times a week, or whatever. I just didn't think it was something inside the house, and it turns out I think it was, retrospectively. So I'll talk a little bit about sinusitis and how to differentiate one from the other. So let's talk about black mold. So you can see I've written a few notes. I'll post these on the blog website. And like I said here, if you see it, you've got it. If you don't see it, you could still have it. So if you think, or if a person thinks that they're exposed to black mold, you just have to search for it. It could be behind a piece of furniture. Sometimes it's under the mattress. I've seen a case of really horrible black mold associated illness, let's call it, speaking generically. I don't recall exactly what the problem was, but this was a person who had made a bed or made a bed frame. And so beds are supposed to have ventilation below them. But this person built a bed frame or a bed structure with no ventilation, and underneath their bed, underneath their mattress, was just black with mold. Now, if you had looked in the room uh, without, looking under the mattress, they would have never found it. But it was the structure of the bed that they had created. So it was a homemade bed frame. Let's see. So my screensaver keeps popping up. Uh, so I'll just read this for the sake of completeness, and I may make some changes to it as I read it, and then I'll put it up on the website. So black mold, do you have it? Obviously, if you see it, you've got it. So if you encounter something that looks like this is obviously black mold, generically speaking. Uh, like I mentioned before, we had some down in the in the basement in the garage area as well, and it was just pure black. It looked like black paint, basically. And I tried to spray it off with a power washer and it wouldn't come off, so that made me think it was either old or dead or just not worth worrying about, so I didn't do anything about it. If you see it, you've got it. If you don't see it, then it might be behind or under the bed or the mattress or behind the furniture or in a basement or attic or below the sink or behind the commode. Those are all common places. If it's outside in the surrounding area, it could still affect you, especially if you're vulnerable or sensitive due to whatever nutritional or hormonal or other problems. But obviously, the concentration would be much less. Uh, Worst case scenario is when it's in a bedroom or a place where somebody's kind of enclosed and spending a lot of time, and that is ultimately what happened to me recently. Again, I thought it was just pollen, or I thought it was allergies, or cutting the grass, or the hyperbaric chamber, because I hadn't changed the filters in my hyperbaric chamber for a while. And so I was distracted by those things, whereas I think I was probably affected by the mold, and then the other things were just the secondary triggers, like cutting the grass and hyperbaric chamber. Let's see. So if you've got black mold inside your car, office, workshop, or home, you might tolerate it for a while, like I did, but then not. A person could become less tolerant due to some other problem, like I just mentioned. Their hormones change, or they become nutritionally deficient. We'll talk about that later. Or other allergens might kind of bloom on top of the mold, so to speak, physiologically, that is, not physically. So anyway, that's what was kind of going on with me, and that's why it took me a while to figure it out, and that's why I'm talking about it now. So when people talk about like black mold toxicity, they're usually talking about systemic manifestations. In my case, I started to get sinus congestion, and then I got a few sinus infections, one right after the other, and none of that made sense, which is why I kept looking for solutions, and eventually I found out it was the mold that I had considered a little bit, but I just didn't really think it was a problem. But things change, In the winter, where we live is very cold, and so we get a lot of condensation inside the house, and that's where the mold started. Was just from wintertime condensation. But then when we got hot weather and more humidity, I think what had previously been mold that was kind of stable, then the mold started to kind of blossom and grow, and that's why it became a problem. So even though I had seen it before and I wasn't really concerned about it, it became a problem with the change in the weather. Not necessarily because of the allergies outside, which could have been a combined factor, but rather just because I think the mold itself blossomed. Uh, let's see. So, how to get rid of the problem? If it's a physiologic problem, then you either have to get rid of the exposure or get rid of the response. So, I'm sure some of you are familiar with that language in the functional medicine world. We talk about triggers, and then mediators and responses and all that kind of stuff. So, but another important point is if somebody is sleeping in a room that has black mold in it, they're only going to be able to tolerate that for so long, and eventually they're going to have problems. Usually it starts with the nose, then it goes to the lungs, and then it goes systemically. And the systemic manifestations of black mold exposure can be um, autoimmune type conditions like ankylosing spondylitis and multiple sclerosis. So it can get pretty bad. So, even if you're a tough guy or a tough woman, or, we all have to, we all want to be tough, but at some point we all have to take care of ourselves and say, hey, I shouldn't be sleeping with that black mold. The other thing is, when I talk about when I say the phrase black mold, I am mostly talking about black mold like Stachybotrys. But typically within microbial colonizations, as many of you I'm sure know, within microbial colonizations, there are typically other microbes as well. So it could be different types of mold, it could be bacteria and things like that. So as things develop, they become more complex. And then they protect each other, and it's kind of this biowarfare thing, all within uh, biofilms and all that. Maybe I'll talk about that more later, especially ways to get rid of it. So when you think about black mold and black mold illness, it's kind of like invisible chemical warfare. So mold and fungi communicate, fight, and defend their territory by producing volatile airborne chemicals that are obviously biologically active. The more complex the multi-organism biofilms become, they can also contain bacteria that produce endotoxin or LPS, which is commonly considered the most potent pro-inflammatory agent known to biomedicine. So again, it can start off as mold, but then let's say the mold starts to build a structure like a biofilm. Then bacteria from the environment can live in that biofilm, and then you've got mold and bacteria and LPS, and that's how this whole thing can basically go to hell in terms of severity. I mean, the thing just spirals. And that's how people get, colossally sick, and they end up with things like I said before, like autoimmune type conditions. Ankylosing spondylitis and multiple sclerosis are the ones that I've seen mentioned most forcefully in the research literature. This invisible and mostly odorless airborne chemical warfare is inhaled into your body, first the nose and the sinuses, which is where I was, then the lungs, which is where my girlfriend was, and then the entire body. Systemic autoimmune disease, also multiple sclerosis. So I'm familiar with several different cases that were diagnosed as multiple sclerosis after black mold exposure, and then the condition went away with remediation of the black mold. A lot of medical organizations deny this association, but that's because I think they're just trying to protect their turf and also defend other corporate interests. And within the functional medicine world, we also see some profiteering, of course, overdiagnosis and overtreatment and undermanagement. Commercial laboratories may overstate and misrepresent the idea that fungal toxins in the sinuses are absorbed systemically for toxic effects. Publication of this marketing message in peer-reviewed research, which I've seen in 2014, gives the impression that this notion has been substantiated even when the supposed evidence was peer-reviewed, even though they actually misused the evidence. So I'll show you what I'm talking about here in just a moment. So we'll look at this in just a moment, but let's see if I can show you the research article that really bothered me, actually. It's not this one, I don't think. No, this is the one that I like. This is the one that I don't like too much. So this was published in 2011. No, I'm sorry, this is not it. It's a similar looking journal, but it's not that one. Let's look at, nope, sorry. I tried to organize these in my software program wouldn't let me reorganize them in the way that I wanted. So this is the one that I don't like. Yeah, it was 2014. So this was, supposedly peer-reviewed, supposedly legit, and maybe it was peer-reviewed and legit. Peer-reviewed only means that a few people read it and then they said, okay, yeah, let's publish it. It doesn't mean that they totally agreed with it. It just means that they thought it was good enough, whatever that standard is for them. So this was published, at least one of these people works with this laboratory. So I assume that means this has some commercial conflict of interest. So I haven't read this article recently. I did read it, as you can tell from my highlights. I read it many, many years ago. And here's the part that I didn't like. Urine mycotoxins in chronic rhinosinusitis patients. In a study of rhinosinusitis patients, Dennis et al., 8 patients underwent urine mycotoxin testing for mycotoxins that were sent to a lab. Of the 8 specimens tested for mycotoxins, 87% were positive, and they're talking about urine testing. Or they're trying to distinguish urine testing. Mycotoxins were detected in urine assays. So let's look at this sentence here. Maybe I'll highlight it if I can, especially if I could highlight it in a different color. Mycotoxins were, I guess I'll go ahead and do it since I'm thinking about it. Sorry, this will just take me a second because this is the sentence I don't like. And I'll show you why I don't like it. Mycotoxins were detected in urine assays in 4 of 18, so that's 22%, at 2 times the standard deviation above the limit, and all were ochratoxin. Well, that's a heavy statement. So what they're trying to say here, or what they are saying, or what they are saying and what they're trying to convey, is that patients who have chronic rhinosinusitis have chronic fungal infections in their sinuses, and that the levels of mycotoxins absorbed systemically are so high that you can actually measure them in urine. That's what they're stating here, and they're citing another article in that conversation. So this appears to be the crux of their communication. So I said, wow, if that's true, then let's look at the original data. So I did go back and look at the original data. Sorry, this program's a little bit hard to work with, which is all the more reason why I don't want to do a live event and try to look at this in a live setting, because it would just add that much more complication. So here we are. Here's the original article. So, sorry, I'll show you the original citation. I would love to be able to pull that out. I just can't move it. Close all. Pin current tab. Print current tab now. So here's the legitimate peer-reviewed research. So obviously, journals exist in a hierarchy. An open access journal called Toxicology, or whatever it was called, is going to be at a certain level, whereas a journal like this, a specialty journal published by the American Academy of ONT doctors, otolaryngology, head and neck surgery. I mean, this is going to be a higher level of a journal. So this is the study that was being cited. I sure wish I could pull that out. Full screen, actual size, reverse, nothing. So, see, this program won't let me reorder it, so that's what's screwing me up here. So let me prove that point before I make the point. So they cite article number 40 here. So let's go look at what article number 40 is. It's Lieberman, Jacobs, Fitzgerald, etc. Measurement of mycotoxins with chronic rhinosinusitis. Measurement of mycotoxins. So they don't say in the title where they measured those mycotoxins. I don't think it was that far. So it gives the impression. So here's the article: Lieberman, Jacobs, Fitzgerald. So I think that's why the other authors kind of misused this, is because they thought they could get away with it. So they quote this article as using urine samples to detect mycotoxins in the urine from patients with chronic rhinosinusitis, and that's not what happened here. So again, I saw this, back in around 2014, 2015, when I was preparing the little book that I was writing on the microbiome, and also doing the microbiome video program that many of you are looking at now on the new blog website. And I noticed that the research just didn't add up. So they those other authors cite this study as being a urine study, and it's not a urine study. So let's look at the materials and methods. They actually took tissue out of the nose and found mycotoxins, but they didn't test anything in urine. In fact, if you do, or if I do, a search for the word urine in this publication, and the word doesn't even come up. So at nowhere in this article is urine even mentioned. The mycotoxins that were assayed and measured in this patient population was in the actual tissues from the sinuses that were taken from surgical procedures. So this is a misuse of a citation in order for the other authors to look like their data was supported so they could then sell their lab tests. At least that's the way that it appears to me. But this is clearly an inappropriate use of citation. So let's just look at it one more time. Again, this article was cited as demonstrating mycotoxins in urine, and it's not. It's mycotoxins in surgical specimens. Study was approved. Sinus surgery. Mucus and sinonasal tissues, predominantly from the ethmoid sinus, were collected, frozen, and stored. They don't talk about urine anywhere in here. I've already done an electronic search for the word urine, and the word urine or urinary or anything like that doesn't even show up. Tissue, so again here they're talking about tissue, they're talking about homogenization of those tissues, and they're not talking about urine. So anyway, that's my point is reading research is one thing, but if you read the citations of the research, you'll find a different conclusion sometimes. And sometimes the conclusion is that people are lying. So, we can all complain, and we often do complain about all these medical organizations, especially in the United States. All they have are commercial interests. But we see that in the functional medicine world as well. And so we just have to be careful and read carefully. So anyway, I'm going to post everything that's written here. I'm going to post on the blog so you can take a look at it, and I don't have to read it word for word right now. So how do we eliminate black mold? So some of this is obvious. Again, I'm not trying to create a whole presentation or a class on this topic. I'm just trying to communicate a few things that I'm thinking about and that I've had to do personally recently. So eliminating the black mold problem, which is actually somewhat distinct from black mold itself. So ventilation, so I put a big fan, especially where I sleep, to get rid of the exposure to the mold. If I have mold up on the wall, I don't really care that much. The problem is when the mold, volatile chemicals are affecting me, then that's what creates a problem, and that's what screwed me up for the last couple of weeks. So I've already treated them with chemicals, but in the meanwhile, while the problem is kind of in the process of being addressed, so I used chemical one day, I'll use chemicals again to make sure it's dead, and then I'll have to repaint where the exposure happened. It just wasn't highly visible to me. I mean, you can look at it in the picture, and yeah, it looks nasty, but it didn't look that bad to me, especially when I go into the bedroom in the dark and I'm not looking at it and it's behind a piece of furniture. So ventilation, just dilution of the air, I might say. Ambient is the fastest solution. And I had to do the same thing when I had that house in Houston, Texas. So I bought an old-time house in Houston, Texas. It was the first house I bought. I think the house was built originally in about 1941 or 1945, so it was in the middle of, or end of World War II, when maybe they didn't have a lot of construction materials. And in the South, in the United States especially, a lot of houses are built on a skirt, like a cement skirt that just goes around the house, and then I guess the beams are laid across, and that's the foundation. So I've had other houses that were solid cement slab. This one wasn't pier and beam, it was a skirt with beam. So underneath first of all, the ventilation was very poor, but underneath the house was just water. Uh, so it was just a hell of a situation, as you could probably guess. It just smelled kind of nasty. So the way that I managed that was I just put in what I called a subfloor fan. Uh, and I'm sure I'm not the first person to ever use that term, but I was the first person to use that term in my experience. So basically, all I did is I built a little um, building, kind of the shape of a doghouse, and I butted that up against the only vent that we had for the subfloor, and I just let it run. So I built this little doghouse building to hold a box fan, and I had the air pushing out away from the house, and it just sucked air uh, from the bottom of the house outward, and that actually dramatically and immediately improved the air quality inside the house. Now, I assume I was sucking out the heat and the air conditioning that I was putting in the house, but that's just how it had to be. Uh, I only had that building for a couple of years. It was where my first office was as well, and it was great, and it was a hell of an experience, and it was, all good for the experience. But I was only going to give it so much effort because I knew I was going to sell the building eventually. But that did work. So you either have to ventilate, you have to ventilate where the problem is. If it's under the house, ventilate it. If it's in the house, ventilate it. If you're going to use chemicals, you got to set up the ventilation before you use the chemicals because you don't want to, spray into a closed space. If it's not ventilating enough to get rid of the mold, it's certainly not going to be good at be ventilating enough to get rid of the mold plus the chemicals that you're going to put on top of it. So we typically think of mold as needing two things. One is a food supply, and the other is water. Well, in most places, ambient air provides enough humidity, and ambient organic material floating in the air can also provide enough food for these microbes. So, you know, the idea that it has to be, wood or drywall or paper or wallpaper that gets wet and then that becomes a food source for the microbes. Yeah, that's the worst case scenario, but I've seen black mold grow right out of dry cement, that maybe it's a retaining wall that has some dirt behind it or something like that. So it gets a little bit of moisture, but I mean, you're looking at mold growing straight through the cement without any organic material. But if applicable, you have to address those things. So start with ventilation, reduce the water or the humidity or the condensation, get a dehumidifier, reduce anything that's organic. So, for example, like if you have a leak on your roof that's draining water into the house and it's carrying like decaying leaves or something like that, like a tea, we could say, of decaying leaves, then that would probably have some more nutrients in it that would feed the mold. Uh, Antifungal chemicals, you can buy them. A lot of chemicals exist. Of course, they're all toxic as hell. You can also use bleach, diluted bleach, of course. I think it's like a 1 to 10 ratio, 1 part bleach to 10 parts of water. It's very effective. All those things are effective and they're also toxic, so you have to set up the ventilation ahead of time, apply the chemical, remove the excess, and then maybe repeat that uh, a few times, and then maybe paint over it. You can buy certain paints that resist mold or they cover mold or whatever, and I've used those before as well. Make sure the area is dry, fix the leaks, remove condensation, use fans, buy a dehumidifier. We have one that's really spectacular. I had one before. Uh, so let's see, when was this? I lived in Seattle for about 5 years, Seattle, Washington, and for 2 or 3 of those years, I actually lived in a basement apartment. If you can imagine cold and damp. So imagine Seattle, Washington, which is cold and damp, and then imagine living in a basement apartment in Seattle, Washington. So that's what I did for a couple years. It was a cool place and a cool neighborhood, but anyway, that was my first time to ever need a dehumidifier. And now we have one that's actually fantastic. I mean, it doesn't make a lot of noise, and it definitely pulls the water out of the air because we have to empty the tank every couple hours. So, point is, if you've used dehumidifiers in the past, maybe look at getting a new one because the technology has improved quite a bit. Uh, Ventilation, dehumidification, fix the leaks, remove condensation, use fans, buy a dehumidifier. We have a great one. Cover it. You can use, again, you can use certain paints and plastics to cover it up. So let's say you've got black mold. Here's what we did in the garage or the basement downstairs. We had a cement retaining wall, but we were turning that garage into a bedroom. So the guys came in. Maybe they cleaned the wall, or maybe they didn't. Probably not, knowing them. But they basically sprayed it with polyurethane foam, and then they built a wall in front of that. So now we have a retaining wall, a moisture barrier, and then a brand new dry brick wall that's painted. So that's one way to do it. You may have to build a wall on top of your wall, depending on what you're dealing with, especially if you're below ground. And that seems to have done an adequate job for us. All the way to building a new wall and filling the void with polyurethane foam. That's what we did. House maintenance and drainage. I already mentioned my first home in Houston, Texas came with a built-in retaining pond under the house. I put a box fan in a doghouse, basically, that I attached to the subfloor, and then had the fan blowing out. So you can get subfloor fans. You can also get attic fans, of course. But this was a great solution at the time. It worked really well. I also had a leak in that same house. So we had a pond under the house. And then I also had some repairs done to the house. And that resulted in some new leaks. So we had some siding done, and I already knew the roof was kind of unstable because the whole house was unstable. But it was a great location, and it provided me the chance to have a house and an office space, and so that's what I did. And I don't regret that, but it came with some complications. And we had a bunch of mold. So now we just talked about, or I just talked about, we collectively, virtually talked about a little bit about black mold. I don't think it has to be that mysterious, and I've already said everything I want to say about it, basically. I do talk about it, in more like scientific, medical, clinical detail. I talk about it more in the books and videos, but it still kind of comes down to what's practical, and that's what I just mentioned. So let's talk a little bit now about sinusitis, which I apparently still have. Excuse me for hitting the microphone. Um, so I didn't even research this very in much detail, but I did become aware of it. So let's just look at it. So when we talk about sinuses, we're mostly talking about four different sinuses. We're talking about the frontal sinuses, which are right here. We're talking about the maxillary sinuses here. When people have frontal sinusitis, it's usually sinusitis complicated by a bacterial infection. And the same thing is true of maxillary sinusitis. The only additional major consideration that goes on when people have maxillary sinusitis is you have to think about the possibility of a dental infection having extended up into the sinus. I don't know how common or rare that is, but that's part of the differential diagnosis. With frontal sinusitis, again, you're just thinking about bacteria mostly. With maxillary sinusitis, yeah, it could be the same thing, but it could also be an extension from a dental infection, and we'll look at that anatomy in just a moment. You can see the close proximity. If you've got teeth here and a tooth infection there, it could extend into the sinus right here because the roof of the mouth is obviously in close proximity. So frontal and maxillary are the two big sinuses. Then the small ones, and these are the ones that I think about because these are the ones that we have to be concerned about. Ethmoid sinusitis occurs. The ethmoid sinuses or ethmoid air cells are right between the eyes. So if a person has infection and severe pressure between the eyes, that would suggest ethmoid sinusitis. Or if it's deeper or behind the eyes, or if they feel the pressure or pain more on top of their head, that could be pain and pain referral from the sphenoid sinuses. Let's see if we see those here. We don't. But I'll show you in a different image. Those infections can be more kind of consequential. I'm not aware of any major problems necessarily. any infection can extend into whatever's next to it. But that doesn't happen too much with the frontal sinuses or the maxillary sinuses, but it does happen with the ethmoid sinuses. So ethmoid sinusitis is somewhat famous or notorious for extending through the bone and into the ocular cavity. So you can imagine an infection here among these very thin bones and very small compartments. You can imagine that getting out of control and then extending into the orbital cavity here. And that does happen. So, one of the ways when I was having this sinus infection and the sinus pressure, one of the ways that I was monitoring it is I'd never had any problem frontal sinus. I never had problems bilaterally. I only had problems on this one side. And I certainly never had anything between the eyes or behind the eyes. If I had had problems between the eyes or behind the eyes, I probably would have taken antibiotics. We've got some azithromycin here, and I've got Bactrim. I could have taken either one of those. So if you look at the microbiology of a sinus infection or a chronic sinus infection, it's everything. When they look for gram-negative bacteria, they find gram-negative bacteria. When they look for gram-positives, they find gram-positives. When they look for anaerobes, they find anaerobes. When they look for mold, they find mold. So that, in my opinion, actually argues against using an antimicrobial drug, because most antimicrobial drugs are, of course, very specific for whatever, gram-positives or anaerobes or whatever. But since it's a microbial mix, I think that argues actually against using a specific antimicrobial agent, because you're not going to get all of them, and then you're just going to kind of kill one to the benefit of the others, because then they'll just kind of live into that niche. So whatever, that's just kind of my way of looking at it. When infections get bad or really painful or whatever, then yeah, I think it's time to use antibiotics. And I love antibiotics. I'm not anti-antibiotic. I love them. But I also, even when I've got a sinus infection and I've got antibiotics in my hand, that doesn't mean I'm going to take them, because I know other ways to get around this. Even though, of course, we all want a fast solution. So here again, frontal sinuses, ethmoid cells, also called the ethmoid sinuses. You can see again, they're right between the eyes. If that infection spreads into the eye, then all hell breaks loose. Maxillary sinuses are right here. I still have a little bit of pressure. And then you can see the teeth right here. So you can see how close these roots are of these teeth to the maxillary sinus. So a dental infection here could extend into the maxillary sinus. Again, be more attentive if you think it might be ethmoid sinusitis, and especially also sphenoid sinusitis, as you can see here. So those are tricky. You can see, what do they call this? The meatus. So sinuses are air-filled pockets that communicate, and the hole between one chamber or a room, you could think of it as a room, the hole between one sinus and another space is called a meatus, which just means an opening. So the problem with any type of sinusitis is that when this becomes inflamed due to whatever irritation, whether it's mold or pollen or hay fever or cutting the grass or whatever, the problem that you see with all sinusitis is that when this becomes inflamed, it closes off this hole. And when it becomes inflamed, you also have mucus that accumulates here. Well, what is mucus? It's basically water with protein. Well, if you've got water, protein, probably some sugars, and of course you've got sugars in mucus because it's a glycoprotein, then it's the perfect, area for bacteria. So, like in my case, retrospectively, I think I was being exposed to the black mold. That was causing some inflammation, kind of like an allergic inflammation, and increased production of mucus. And that was closing off the meatus. Let's see if we see a better picture of it. The first book that I showed you was Netter's Anatomy. This is Gray's Anatomy that we're looking at right now, kind of the new version of Gray's Anatomy. Let's see if that was one. Opening of the sphenoid sinus, but you get the idea. So basically, the allergic type reaction I was having to the mold exposure was closing off my sinuses, and then I was just having a mucus pond right here, and it was filling up with bacteria, and so I was ending up with a secondary bacterial infection, even though the real problem was exposure to the mold. That's my point. And that also explains how we treat this pharmacologically. So how would I treat this pharmacologically? I think I treated it actually pretty competently. That doesn't mean it was perfect, but nothing's perfect except finding the problem and then solving the problem. So what could you do in a situation like that? I used decongestant, so this is just a spray. It's a vasoconstrictor. Consequence of vasoconstrictor, insomnia, hypertension, anxiety could happen. Here's another spray that I was using. Here's a steroid spray, which I actually think works quite well. Maybe not necessarily in this exact case, but I've used it in the past with good success. Oral antihistamines just to reduce the histamine. And then my favorite, one of my favorite drugs, is anything related to prednisone. I do like steroids when I've had inflammatory problems. This is dexamethasone. I think I used up all the prednisone that I have. I like prednisone. I, I have no bones about it. There's certain drugs I like, and these are the drugs I like. I like antihistamines. I'm not crazy about antihistamines. I do like steroids for a lot of different problems. And I like hormones and a bunch of other drugs too. But like, like hormone modifying drugs, like Arimidex, for example, is one of my favorite drugs. So anyway, I think I've talked about sinusitis. So I've talked about sinusitis a little bit. It's complex microbiology. That's why I don't like using antibiotics, because no matter what you use, you're not going to kill everything. So I guess you could make things a little better. And I've had good success actually a long time ago, back in 2011. I had really bad sinus problems. That was exactly 10 years ago. I was waking up every day with sinus problems. And then at the same time, around that same time, I went to a conference and I learned about using azithromycin for Chlamydophila infections. And I said, wow, that could be me. So I took azithromycin and I got sick for a couple of hours and then I felt fantastic. So that was a good experience for me. But I'll tell you the agent that I like the most. This is what I'm getting around to. I'll tell you the agent that I like the most for sinusitis, and that is iodine and iodide. So I'm going to close this because we'll talk about I guess we can talk about iodine right now because I've got the chapter from my book right here. So this comes from my book, Inflammation Mastery. In chapter 4, in chapter 4, as you can see right here, food and basic nutrition. I talk about food and basic nutrition in chapter 4. So we'll look at that section, especially the section that just includes some previously published articles. So I've published something that I call the Supplemented Paleo-Mediterranean Diet, or the 5-part wellness protocol, or the 5-part diet, or whatever. But I guess the proper name is the 5-part Supplemented Paleo-Mediterranean Diet. And it's a healthy diet, multivitamin, multimineral, extra vitamin D, combination fatty acid therapy, which I call CFAT for combination fatty acid therapy, and probiotics. So I started doing that with my patients, 20 years ago? Yeah, 20 years ago. And I remember one time when I was in the office, this was also in Houston, Texas. I remember one time I was walking down the hall, I think it was probably Friday afternoon, and I remember I was kind of bored. I was thinking to myself, God, I just do the same thing over and over again. I talk to these patients and I tell them to clean up their diet and put them on this dietary program. And, so I was walking down the hall and I thought, wow, this is boring. I just do the same thing over and over again. And then basically on the next step, I said to myself, yeah, but it works. So that's why I kept doing it. So I published it in 2004 or 2005. Let's see, when was the first time I wrote it up? 2005, and then I published it again so that was part 1 and part 2, 2005, and then I didn't touch it again until 2011. That was a different nutrition article. So all of this whole thing's available for free. You can download the article. Revisiting the 5-part nutrition wellness protocol, the supplemented Paleo-Mediterranean diet. I wrote it again in 2011. And then within this article, I also talked about, at that time, what I was considering the potential importance of using iodine and iodide, which had become popular based on a very, I'm going to say this correctly, but let me get the words out. The popularity of iodine and iodide came about in this era as a result of a very authoritative misinterpretation of the data. So a certain doctor in the nutrition world started talking about this, and everyone got on the bandwagon. Uh, and then it turns out that he was wrong. At least that's the impression that I take away from that. Uh, but he was wrong in his interpretation or misinterpretation, but the data was still correct. So we did in this case, one of my favorite phrases actually is, in this case, we did the right thing for the wrong reasons, but it's still the right thing to do. So I talked about it a little bit in the original article, and then I had to go back and make some changes because when I looked more deeply at the research, I thought, well, we need to hold on here. So let's talk about using iodine and iodide right now in the context of sinusitis. So obviously we're talking about using this for its antimicrobial properties. So in a lot of pharmacies, you can buy iodine. I'm sorry, it's iodide actually. This is in Spanish, so it's iodide. Sometimes you can buy iodide and iodine together. That's called Lugol's solution. Where I live right now, the pharmacies won't sell it without a prescription, or at least they're not supposed to sell it without a prescription. I actually did get some last year. And I'd be happy to maybe think about taking it, but I can't, I don't know where it is. I don't know what I did with it. I do have this little bottle of tincture of iodine. Sorry, this is potassium iodide. I'll distinguish between those two forms in just a moment. So this is potassium iodide, not supersaturated, so it's kind of weak. This is used for like surgical prep, but I still take it orally. Even though it says don't take it orally, I still do because it's the only thing I can get right now. But here's my point. So iodide, I don't know why it says iodide. Oh, I'm sorry, I do know why it says iodide. I was thinking iodine just for a moment. Let me just distinguish between those two things. So iodine is the mineral, and in its natural form, it's two of them together, so it's diatomic. So that's the natural form, and you can see that here. Iodine is the natural form, and it's two molecules of iodine together. If you separate those and add something next to it, then you have iodide, which is slightly different, even though they're both antimicrobial. So if you want the optimal antimicrobial effect, probably iodine with iodide would probably give you the best results. So you can remember iodide is what you find in potassium iodide because it's divided. It's also the dietary form. So anyway, hopefully that distinction's clear. The more I talk, the more pressure I feel in here. A little bit. It's not bad, but I do feel something here. That's why I'm not speaking maybe as well as I would otherwise. So anyway, we're working our way back to what does this have to do with sinusitis and fungal infections and black mold and all that. Well, this is great stuff because, as you can see here, iodide dissolves mucus, it kills microbes in both forms. So that's why this is something worth using. So if I had to use a drug antibiotic, or let's say if I were thinking about using a drug antibiotic, but I could get iodine and iodide together, I would certainly take iodine and iodide together rather than using a drug antifungal or an antibiotic. Like I said before, if you pick an antibiotic, it's probably going, with some exceptions, like Augmentin, for example. Augmentin kills gram negatives and gram positives. It also kills 90% of your gut bacteria. So that's the consequence of using an oral antibiotic to treat a local infection, is that you're going to kill off a lot of good flora, all for the sake of a temporary relief here, which may or may not even be worthwhile. In contrast, again, if you use iodine and iodide together, either orally or topically, you can direct that antimicrobial effect more locally, I think, without killing off all your gut bacteria. So I've done a little bit of that, and every time I do it, I definitely feel better. I just haven't done it enough. Maybe I'll do it right now on camera just to show you how I do it. So this is coffee, which I'm going to keep drinking. Give me just a second here. It's actually coffee and rice milk. So for example, this is potassium iodide. It's not very concentrated. So sometimes you can find what's called supersaturated potassium iodide. And that's obviously more concentrated. This is not very concentrated. This is 20 milligrams per milliliter, and each milliliter is 20 drops. So that makes this 1 milligram per drop. So you can see some of the doses that are used for systemic fungal infections. And again, you can download this document. I'll put it on the website. You can download this document, and then you've got it. You've got the citations and you've got the amounts. So sometimes they use 11, when they're treating severe fungal infections, they can use 11 grams per day. Again, what I have right here is only 1 milligram per drop. So I'm not getting up to 11 grams with this, that's for sure. Here they used 5 milligrams per day. So for the treatment of systemic infections, we are talking about grams per day. If we're talking about hormonal changes, like you can get an anti-estrogen effect from iodine-iodide, then you're talking about milligrams. In my case, sorry, I'm going to show you. Here they sometimes 3 and 6 milligrams. That's all reasonable. And I think it's great. I think this is one of the treatments that we all tend to overlook and not use enough. This is actually one of my favorite coffee cups. It's much prettier on this side. This side's not so pretty, but the side that I see is actually quite nice. And I'm about to use this coffee cup to show you how to take iodine. So all the details of how I do this are actually already here in this document, so you can just download that. But let's say that I actually wanted to take some iodine right now, even though this says don't take it orally. I've already done it a few times and I obviously lived through it. Oops. And actually, sorry, it's got a little bit on my hands. And I feel better every time I do it, which is kind of why I'm inspired to do it right now, even though it's a little bit spontaneous. So again, this is 1 milligram per drop. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Maybe a few more. Call it somewhere between 10 and 15. And again, this is 1 milligram per drop, so I just put in, let's say, 15 milligrams. And this is potassium iodide. It's not supersaturated. But it does work. I've read some other studies where they specifically, so back, before our dependence on antibiotics for everything and mucolytics, like drug mucolytics, this is what was used by the medical profession. And I remember seeing one study in particular, maybe it was an editorial. This would have been back in like 1956 or so when it was written. And what they said is that if you take iodine-iodide, if you take iodide orally, it passes through the digestive system and into the respiratory secretions within 15 minutes. So that's pretty amazing. So again, this taken orally gets absorbed very rapidly and gets excreted into the mucus within 15 minutes. Maybe we'll see how it works in real time. Can't even taste it because it's mixed with my coffee and rice milk. So anyway, why would we do that? Antimicrobial and mucolytic. If someone is having a sinus infection, that's exactly what they need. They need broad spectrum antimicrobial. It kills viruses, it kills gram-negative bacteria, it kills gram-positive bacteria, it kills anaerobes, it kills fungi, yeast, everything. It kills everything, and it's mucolytic. If you're talking about somebody who has, like this pool of mucus that needs to be cleared, what they need is a mucolytic antimicrobial agent, broad spectrum antimicrobial. So iodine is perfect. And I'll show you how, I guess maybe I'll show you that right now. I'll show you how I apply that. So we talked about black mold, see video discussion, nutritional immunomodulation. So just think about vitamin A and vitamin D. Those both promote defense and tolerance. So that's why I include them within the nutritional immunomodulation and also in the kind of immune defense protocol, which is within the antiviral protocol. So I talked about iodine and iodide together. That's also called Lugol's solution. I've shown you that information right now. You can download that section and look at the citations and all that. I actually saw a more recent article. I don't recall the publication date. I just saw it last week. It was printed in Spanish, but the abstract was in. They had an abstract that was in English, and between all of that, I could figure out enough of it. And they were using iodide in the treatment of acne, cystic acne, and they got really good results from using that. So what else do we want to say here? Video discussion, combination, so nutritional immunomodulation, diet. Here we are. So topical intranasal sinus rinse with iodine and iodide. So I guess it's one of the last parts that I want to talk about. So here's what I do for my sinus rinse program or protocol, and I'll tell you why I do it. And I think it's great. I like my program basically better than anything I've seen. I have seen, what's it called? I don't know what the machine is called, but I have seen recently videos about a proprietary machine that puts in salt water in one nostril and pulls it out the other. I'm sure that's a hell of a ride. And sure, yeah, maybe it's great, maybe it works. I'm going to show you what I do, and this is what I do. So a lot of people use tap water, and you should not use tap water to clean out your sinuses. For this very specific reason. Several case reports have been published of people doing sinus rinse with tap water, and these were patients mostly in the United States. However, I do recall one case that was published out of Spain. And basically what happened is people got water up their nose, either accidentally or intentionally, and they also received an amoeba in their nose, and that amoeba is called Naegleria. And that is the brain-eating amoeba. Virtually 100% fatal. The one case that I'm thinking of that happened in Spain, a young girl got it in a swimming pool. She got Naegleria, and I think she's the only person to have ever survived. So most people who get Naegleria get it from water. It's fresh water. It's not salt water. They get it in the water, and it goes up their nose, enters into their brain, and destroys their brain. Again, that's called Naegleria. It's also called the brain-eating bacteria. And you can get that in tap water, and if you put it up in your nose, you could end up dead, or a person could end up dead. So that's why I don't use tap water. This is supposedly sterile saline, physiologic saline, for intravenous infusion. So I buy these at the pharmacy, either in 1 liter, so this is obviously this is 1 liter. Sometimes they don't have 1 liter, and I buy 500 milliliters, and that's fine too. To do both sides, I think 1,000 milliliters or 1 liter I think is fine. If for whatever reason you just want to do it really quickly, or if you're only going to do one side, you could do a 500. But basically, it's 500 per side. So 1,000 if you're going to do it right. So here's how I do it, and I am trying to make sure that this gets into the camera so everybody can see. So basically, I take something that's semi-sharp or semi-dull. In this case, I would take a pair of scissors with kind of a dull tip to it, and I want to poke this through. I'm not going to do it because I don't want to risk getting water here on my computer. But I would aim for the corner of the bottle here, and I'm going to put this into the bottle, and then I'm going to poke it through and twist it. I'm trying to create a round hole. I'm not trying to cut the bottle. So this is a plastic bottle. I'm going to aim for the corner here. I want to make a round hole. I don't want to necessarily cut it, even though I have done that before too. So now I've got my liter of sterile physiologic saline, and now I'm going to take, in this case, 10% povidone iodine, and I'm going to put that into the hole, and I'm going to squirt it in there, just kind of like this, kind of a squirt until it looks kind of tea-colored or brown. And I'm going to call that sufficient. I'm going to call that good enough. And then mix it around a little bit like this. Again, I've got my hole here, and then I basically put that up to the nostril, lean over the sink or the bathtub, or if I'm outside in the grass, I just do it out there. And I squeeze the bottle. This stuff shoots in one side, comes out the other, and I do that until the bottle's done. If somebody's really slow and resistant and they don't want to do it at all, it takes 3 minutes, because I've done it that way. The other day I didn't want to do it, so I timed myself. I said, well, how long can I drag this out? And it was 3 minutes. But if you just do it quickly, again, you make a hole in the corner, you're trying to make a round hole. You're not trying to cut the material. You're trying to make a round hole. You're going to put your iodine in there. You put this here, you squeeze it in. You go to the other side, you squeeze it in. And that's what I do, and I've been doing that for years. It's not like I do this all the time, but when I have to do this, that's what I do, and it works very well. If you put too much iodine, so this is povidone iodine. If you put too much, it'll burn. And it's also kind of volatile and irritating, so you can do this and feel worse, and then later on you feel better, or the next day you feel better. And you don't have to put the iodine in there at all. And since none of this is medical advice for anybody, you don't have to do any of this. I'm telling you what I do, and that works. The other part of the evidence base, let's say, that supports doing this is that this is, I believe, FDA approved for pre-surgical preparation for open heart surgery and for orthopedic surgery. And here's what I mean specifically. I think they use a 5% solution just to sterilize the nares, and that's just right here at the kind of entryway or the doorway, so to speak, of the nose. 5% iodine there drastically reduces the incidence of postoperative infections. So the precedent, iodine surgical scrubs have been used for preparing surgeons before they go in, and also preparing the field prior to surgery or prior to cutting. And so this has a long history of use in surgical settings. We also have evidence of it being used successfully in the treatment of sinus type problems, kind of like mupirocin. Mupirocin cream is an antibiotic that's often used to sterilize the nares or to get rid of Staphylococcus aureus. And you can do the same thing with 5% iodine. So all of that's well established. So the step that I've taken here is just to put it in the saline solution, squirt it up, and clear it out. And again, that's what I do. So I'll walk you through it one more time. Find the corner of the bottle, make a hole. Now we've got a round hole there. We're going to squirt this in. This is just povidone iodine, 10%. It's going to be kind of tea colored. If you make it too strong, it's going to cause irritation. If you don't make it strong enough, potentially it wouldn't work well enough. You just have to gain experience and do it yourself if you're going to do it. But again, I'm not advising you to do it. I'm just telling you how I do it. But you've got a broad spectrum antimicrobial, antifungal, antibacterial, mucolytic agent going right where you need it. That's about as good as it could possibly get. And then if you're also getting it from the inside with this, then I think that that's a reasonable treatment. So that's how I do my topical intranasal sinus rinse with iodine and iodide using sterile saline. Again, if you use tap water, you run the risk of exposure to Naegleria, and Naegleria is fatal. Uh, if if I had access to everything, which I don't, where I live because a male is too complicated, I would prefer to take iodine and iodide together as a tablet from Biotics Research. Their product is called Iodozyme HP for high potency. And I will show you that product right here. This is obviously just the bottle. And let's look at the label, which I believe you can see here. Maybe I can make it a little bigger, maybe not. I thought it would get bigger. There we go. So half a tablet contains 6.25 milligrams, so a whole tablet then would be 12.5 milligrams. If I had a bottle of that, and I have taken it in relatively high doses. So I think the most I've ever taken. So each tablet's about 12 milligrams. Uh, when I've taken it in the past, and I don't recall exactly what the situation was, but I do recall taking 4 of them. So that would have been 48 milligrams. Again, if we go back and look at the research, so acutely I've certainly taken 48 milligrams, and here for this particular study they were using about 5. In this study they also use between 3 and 6 milligrams. But if you look again at the infection studies, they were using 11 grams per day, so 1100 milligrams. Here they used 2300 milligrams, so 2 grams per day. So that gives you some perspective on basically hormonal changes. You're looking at a few milligrams. For antibiotic effects, you're looking at up to grams per day. But again, these are serious infections for which the patients couldn't benefit from other treatments. So the risk-benefit ratio is completely different there. So this is not something that, any novice would necessarily do at home. These are patients under clinical supervision. The risk is moderated by the fact that they need effective treatment and they've failed other treatments. So, the whole conversation is different in that setting. Let's look at let's look at some of the other articles that I've pulled up here just as part of the conversation. Damp, moldy homes tied to chronic inflammation. This was published in 2017. Allergies, asthma, breathing disorders. Not too good. Not too important. Hyperbaric oxygen. Mixed mold exposure. So again, we talk about black mold. That's just what it looks like. That's just a generic description, but the mold itself is actually a complex mixture of different things, different microbes. Some other studies were published by Bill Ray. Here he is, Bill Ray, right here. So I actually worked as a medical student. I actually worked in Bill Ray's office. I don't want to say that I think he passed away within the last couple of years. But I actually worked in his office as a medical student for a couple of weeks or a month. I think it was 6 weeks. I finished medical school in Fort Worth, Texas. He was in Dallas, so it's just about an hour from where I was living. And that was 2010, so that was about 11 years ago. Anyway, if you don't know, then you should know. Bill Ray is like one of the godfathers of environmental medicine. In fact, he probably is the godfather. I'm sure we have several different people who could be considered godfathers, but Bill Ray is definitely one of them. And then, he taught, or I should say, in the succession was Crinion, who was also my teacher at Bastyr. So anyway, if you want to look up research, these would be the people to look up. You could look up Walter Crinion's work. You could look up Bill Ray's work. You could also look up some of the other authors that we'll look at here very quickly. Oh, yeah, so remember what I mentioned earlier? This study was actually published in my last year of naturopathic school, so 1999. This was a big study that we all looked at that time because we were working in the clinics with patients with sinusitis, and we said, wow, all of them have fungus. All these chronic rhinosinusitis patients have fungus. So anyway, that's why you don't want to think about just treating them with a antibacterial antibiotic, because then you're leaving the fungus in place. This study was actually kind of boring, so we won't look at that. Mycotoxin-induced neurotoxicity. We looked at that one already. I'm not going to look at that one. Water-damaged home and health occupants. Let's just see what this one says very quickly. There's Mr. or Dr. Sorry, I don't know what his credentials are. They're talking about, looks like some histamine, kind of mast cell disorders. Let's see what this one is. Oh yeah, this is really interesting. This is like one of the worst case scenarios. Fungal exposure endocrinopathy. I mean, who would think of that? I never heard about that in any of the schools I went to. Fungal exposure endocrinopathy in sinusitis with growth hormone deficiency, Dennis Robertson syndrome. So, where's the definition of that? I thought it was the part that I highlighted. Let's just look at this real quick, or not. Adult onset. No. Maybe it's already self-explanatory. Causal relationship between fungal exposure, chronic sinusitis fatigue, anterior hypopituitarism, and growth hormone deficiency. So if you're interested in that, you can look it up. But I remember looking at that many years ago. We already looked at that one. Algal bloom. We'll look at the next. Shoemaker was the other author that I was going to mention in all of this conversation. He's definitely done quite a bit of work and has lots of publications. Last time I looked at this data, I wasn't very impressed by some of these position statements, but you can look at those yourself. We already looked at that. Yeah. So if you look at my inflammation mastery book or the section on dysbiosis, I think I talk there about some of the complications of mold exposure. And like I said, usually starts in the nose, then goes to the lungs, and then becomes systemic. And the systemic complications kind of look like autoimmunity, or they look like ankylosing spondylitis, multiple sclerosis, things like that. That might be it for today, at least for this conversation. Again, that was the black mold that I found kind of hidden. No obvious source of water and no obvious source of like carbon or carbohydrate or decaying leaves that were seeping through or anything like that. So this is just condensation from winter that bloomed in the summer. And I didn't really care about it until I had to care because I couldn't get over this thing. Apparently that's kind of a weak spot for me. So when I get sinus infections, it's always on the right side. I had allergies when I was a kid. I had sinus surgery when I was 18 or 19, when I was still living in Houston, Texas, and I don't really think it did much for me. I'm sure it made the doctor about $30,000 or whatever, but I don't recall getting much out of it. That was such a sick experience, and here's the sick part about it. It wasn't anything related to me, it was what the doctor said. So I grew up in Houston, Texas, had a lot of allergies. But in this case, I went to see this doctor when I was about 18 or whatever, and I very clearly remember the conversation. So this would have been about, let's say, 1990. Yeah, 1989, somewhere around there. That's when HIV and AIDS was still relatively new. And so I had allergies, and he told me, he said, look, he said, either you can have sinus surgery or take these medications. Or he said you could get AIDS, because if you get AIDS, it'll destroy your immune system and then you won't have allergies anymore. So what do you want to do about it? So I was like, well, I don't want to get AIDS, so I guess I'll take your medications and then we'll do the surgery. So I just thought that was really manipulative of him. But anyway, those were the options given to me back when I had a lot of allergies and sinus problems. So Apparently, I have some predisposition toward that, maybe anatomically, but every once in a while it gets me, and it just got me recently. When it got me before recently was 2018, so that was 3 years ago. Um, and it was because this was a really interesting trigger for recurrent sinusitis. So I had sinus infections almost nonstop for about 2 or 3 months back 3 years ago. Very clearly, it was 2018. And the reason I know it was 2018 is because we went to Amsterdam and I bought a leather travel bag. And I liked looking at it, so I had it sitting right here hanging on the wall. I just liked looking at it. It was a beautiful bag. It's part of the reason I went to Amsterdam was to buy this bag. And the chemicals coming off of that bag gave me enough irritation to create this vicious cycle of mucosal edema, followed by closure of the meatus, followed by mucus swamp, followed by bacteria. I just kept getting sinus infections over and over and over again, and it was because of the chemicals that were coming out of the leather into my office, because of course I was sitting here working. And anyway, that was just another event. Quite similar to this one. It was actually, I think, worse. Sorry, now that I think about it a little bit more, that sequence of sinus infections at that time actually started with exposure to eucalyptus, one of my favorite plants, but I burnt some decaying eucalyptus thinking that it was going to smell really good, and that totally set me off. Horrible allergies. And then the next day is when we left for Amsterdam, and then I came back with the bag, and then the allergies and the sinusitis just kept going. So anyway, you've got to think about what's causing the triggers, or what's triggering the situation, and then kind of do some investigation and then just try to unwind it. So in this conversation, we talked about the difference between conversation, lecture, presentation, long form. I'll try to provide some clips just because I think they might add some value. I talked about sinusitis and black mold. I think I said everything I want to say about it without doing much investigation. I talked about sinus lavage and why I think mine is the best and the safest for what should be obvious reasons, namely avoiding Naegleria. I talked about iodine and iodide, how those can be taken topically through this lavage, but also can be taken orally for antimicrobial benefit. You can look up the citations in the PDF. Mucosal defense and immunotolerance, you can achieve both of those with nutrients like vitamin A and vitamin D just to get you started, but obviously I talk more about that in chapter 4 of the book. And if I get a chance, I'm going to include a clip about some really awesome leadership that I saw in a video today. I might add it as a separate video, and it'll be on the blog or on my Telegram feed. But I do feel respectful of some leadership that I saw that I think deserves a broader audience. So I'll probably share that either within this clip or in some separate clips or both. So just keep an eye out for that.
Increases in COVID suicides are way more than COVID deaths. How come no one's looking at this information? Why aren't they understanding that this is stupid? It doesn't make sense. Again, there's a ton of articles showing the increase in suicide. I have friends that their kids are going to different schools and they can't even look at me. They're always looking down. They're afraid to hug me. Not the kids at my school though. I get rushed with hugs all day long. But my friends that their kids are going to other schools, I said, don't you see your child is very different now? And their response to me, what am I going to do? Well, you know what? If every parent stood up and fought back, do you think these schools would continue this nonsense? Absolutely not.
I'd like to read something.
Sorry, I'm running out of time. There's some great videos there for you guys to watch later. This is a great study that was done with 10 million participants. They were not able to find this mysterious asymptomatic spread. The cases that we had at school all came from the parents. I didn't see one situation where kids were giving it to each other. It's a lie. It's only meant to keep people in fear, so they blindly follow these ridiculous rules. There's an increase of $3 billion for adults, $4.2 million for kids in mental health needs. So when is the solution way worse than the virus? In this case, it is. And until we stand up and say no and do what we need to do, it's going to only continue. And that's not a path that we want to go down. Kids are not to blame. These kids, they have one chance of being amazing little human beings, and if we destroy their emotional well-being, it's going to be so much harder to repair. It's going to take years and years of getting them back on track when we can just stop this nonsense now. Now's the time to do it. None of this warrants anything that they're doing.
All right, well, thanks everybody who attended this, and hopefully you got some good things out of it, and you got to see kind of the thought process behind some of these interventions that I think we can use to good benefit. All right, everybody, take care, and we'll be in touch soon.